Good evening. At this time, I'll call the Randolph County Board of Health September 13th, 2021 meeting to order. Certainly thank our folks in the audience for being here tonight and anyone watching online. We appreciate you being online watching and your interest in our work here. At this time, I will open up the public comment period. Is there anyone in the audience that wishes to address the board? And Brooke, I did not receive any emails, so don't know of anything from there. So, hearing none, I'll close the public comment period. Board members, in your packet, you should have received the minutes from the July 12, 2021 meeting. I'm going to look at those and make sure you don't see any adjustments. Board members too, if you'll make sure your mics are so that we can talk into them if we're making motions and that sort of thing, or comments. Is there a motion to approve the minutes for July 12, 2021?
I move to approve.
Courtney is making the motion. Do I hear a second?
Second.
Alan made the second. All in favor, please signify by stating aye.
Aye.
Opposed? All right, motion carries. So the board minutes for July 12th have been approved. Next on the agenda is a Health Promotion and Policy Division update from Amaris Avalos and Wendy Keenan.
Hello.
Thank you.
I'm just going to do a real quick Health Promotion Policy Division. Is there a way to move this? So this is my coworker, Amaris. She's our other public health educator. She has been in the other team of us, Melissa, have been phenomenal throughout this COVID. They've known nothing but COVID. They came in to the EOC during COVID and have been phenomenal. So they're learning now a little bit more about health education and what their role is. But anyway, I just want to give you a little bit of an update as to what we've done recently. I worked with Jennifer, our new assistant health director, to draft the strategic plan for which I will go over for y'all this evening. And like I said, without Jennifer, I would not have been able to get the strategic plan done for you, and it would not have been given out tonight. So she is phenomenal. Amaris, after me, is going to present the 10 essential services of public health. The health promotion team has been inundated with answering the phone hotlines, both the hotline and the vaccine appointment line. When the state staff are not in the, well, I guess technically what's our EOC, when they're not in there, then we're responsible for answering the hotline. Sometimes it's call after call after call and you can't get anything else done, and then sometimes it's just extremely slow, so you just never know from day to day. We do on Thursdays and Fridays answer the vaccine appointment line because the staff that is inside for the state is outside doing vaccine. So we follow up on complaints that come in regarding the schools and businesses. We don't have a lot recently coming in from the schools. Now, Tara may say different because she's working more closely with the school systems than I am, but businesses, we do have quite a bit of complaints about them not being compliant and about them not making their staff wear masks or social distance or anything like that. So Melissa, our other team member, she handles those business calls really well. Keeping social media updated. The information is constantly changing and we're constantly updating it. Amaris is phenomenal. I told her with her 1-year anniversary, I said, you need to count how many flyers you've done since you've gotten here on Canva, because I feel like every time I turn around, I'm like, will you do another flyer? Will you do a flyer on this? And she does it, and she's wonderful on it. So kudos to her. Health Ed team is working with our IT, Ernie and Joy, on updating our website. Melissa, our other team member, is developing a diabetes collaboration. This is going to include implementation of a diabetes self-management education program. Diabetes education is lacking right now in Randolph County, unfortunately, and Melissa came from us from Mercy, but that was her baby, was diabetes. She's going to be working with partners to include Mercy, Prevo Drug, and Hodges Family Practice. And then lastly, we're working to update the community health improvement plans from the 2019 CHA, for which I presented to y'all a couple months ago. Any questions for me? Okay, at this moment, I'm going to turn it over to Amaris. This is Amaris Avalos, and she's going to do the 10 essential functions of public health for y'all.
Thank you.
Thank you, Wendy. So again, my name's Amaris, and I'm going to be doing a presentation on the 10 essential functions of public health. A little background on myself. I did graduate from UNCG back in May in 2020, right when COVID had hit. My degree is in public health. And can you guys see the screen
We'll
in
get our
front of
screens
y'all?
up.
Okay. So just let me know when y'all are ready.
Good, go ahead.
Okay. So, okay.
Wendy,
Okay, that's fine.
Wendy, get her, pull her mic down.
Pull the
Get her,
mic
pull her
down.
mic, yes. We need to make sure anybody listening at home can hear.
Okay, is that better?
There you go.
Okay. Cool. Okay, so the 10 essential public health services are to protect and promote the health of all people in the communities. It's basically a framework that public health can follow. And the purpose of it is just so everybody can have a fair and just opportunity to achieve good health and well-being. So if you look around the circle, you'll see that there's 3 different groups. Group number 1 would be the assessment. So the first service is to assess and monitor population health status, factors that influence health and community needs and assets. Some examples include the conduct of the community health assessment that's done every 3 years, the lead community coalitions such as Save Kids, Opioid Collaborative, and Healthy Randolph. Service number 2 is to investigate, diagnose, and address health problems and hazards affecting the population. This is where environmental health investigates reports of potential food poisonings or illnesses associated with local restaurants, and communicable disease alerts to outbreaks such as hepatitis A. Now, starting with group number 2, which is policy development, service number 3 is to communicate effectively to inform and educate people about health, factors that influence, and how to improve it. An example is the COVID-19 pandemic led the emergency response team to create communications via social media or press releases, just like Wendy was talking about those graphics about COVID-19 that I tend to create, and also the rest of the team. That's an example of that. The RCPH annual report, and also the community health assessment. Service number 4 is to strengthen, support, and mobilize communities and partnerships to improve health. This is where, again, the lead community coalitions such as Save Kids, Opioid Collaborative, and Healthy Randolph. And then also during the pandemic, the Randolph County Public Health worked closely with schools and businesses. And again, like Wendy said, we are still doing that up today. Service number 5 is to create, champion, and implement policies, plans, and laws that impact health. Examples are the Board of Health rules, Healthy Randolph Community Health Improvement Plans, also known as the CHIPS, advocate for state policies related to health, for example, banning smoking in public places. Service number 6 is to utilize legal and regulatory actions designed to improve and protect the public's health. The example is communicable disease follows North Carolina DHHS laws regarding highly infectious diseases, conducting case investigation, contact tracing, offer treatment, such as COVID-19 or TB. And the last group that is called the Assurance Group, service number 7 is to assure an effective system that enables equitable access to the individual services and care needed to be healthy. So again, conducting the community health assessment or referring clients to local providers such as Mercy for primary care for those who are uninsured or underinsured. Number 8 is to build and support a diverse and skilled public health workforce. Examples would include recruiting highly qualified applicants for open positions at Randolph County Public Health, and also all staff are required to complete various types of training annually. Number 9 is to improve and innovate public health functions through ongoing evaluation, research, and continuous quality improvement. Example would be annual performance measures are evaluated to ensure reflective of evidence-based practice and effectively measuring programs, and also meeting the North Carolina accreditation requirements. And number 10 is to build and maintain a strong organizational infrastructure for public health, holding public Board of Health meetings, and working with county leadership and elected officials to ensure collaboration across agencies or government bodies. Does anybody have any questions for me?
Any questions for Amaris? I think sometimes this gets lost in the shuffle of all the work that goes on, and certainly you guys have been doing a lot of other stuff in addition to your job, so we appreciate what you do. So any comments or anything from the board? Okay, thank you, Amaris.
Thank you. And it was nice meeting everybody. Thank you for the opportunity.
I want to quickly add that Amaris's position came to be during COVID. During our COVID response when we were in the EOC, we saw that we needed a health educator that could help us reach to the Latinx population. So the Board of County Commissioners approved that position. So that's how we have Amaris, and we're happy to have her.
Glad you're here. Thank you.
Thank you.
Wendy, you're next on the agenda, right? Okay. Wendy will be talking about the strategic plan presentation and update.
Okay, so I'm going to present on the 2020 strategic plan. I realize it is late of 2021, but here we go. Okay, seems like a lifetime ago, but on December 4th, 2019, a strategic planning advisory committee met at the Emergency Operations Center of Randolph County Emergency Services. That planning advisory committee consisted of public health management team, a board of health member, which was actually Marty, and then our partnering agencies. Input that we received that day, along with issues identified in the 2016 countywide strategic plan, the 2017 Needs Assessment and Health Equity Data Analysis Randolph County Report, and from the 2019 CHA, 5 priority areas were identified. First one was enhance access to medical, dental, and mental health services in the community, promote wellness and lifestyle changes through outreach and education, enhance communication and marketing, integrate technology into clinic services, education, and outreach, communication strategies, and data analysis to ensure patient-focused care. And then finally, obtain funding through grants and public health department revenue to meet and/or exceed revenue budget targets. So as far as the priority areas that we identified, those 5, each one of them includes strategies that will explain what we will do to accomplish these priorities, a projected outcome, persons or organizations responsible for the specific strategy, a time frame to accomplish each of these strategies, and then progress and outcome. Y'all will be updated annually as far as what's going on with the strategic plan. So this is going to be a small update. We have fortunately made some accomplishments throughout 2020 and 2021. Okay, so if you turn to page 15, as far as the strategic plan report that I think was sent to y'all previously. Priority number 5 was to obtain funding through grants and health department revenue to meet and/or exceed budget targets. Objective number 1, by December 2022, expand financial reporting and debt set-off. Within that objective, that strategy is to continually seek grant funding for dental health program. And I'm sure you've also been made aware, but here are the 4 grants that within 2020 and 2021 our dental health program received.
Now, one of those was fairly recent.
Yes, the Duke Endowment Grant was, I think, the most
375,
recent.
that's what I was thinking. Okay.
So again, under priority number 5, objective number 2, by December 2022, secure 2 to 4 new grants to support health department focus areas. Strategy 5-2A, we'd like to participate in the Minority Diabetes Prevention Program, for which we have done 3 years already. We did receive grant amount in 2020 in the amount of $10,000, $650. We did implement a 3rd class in January of 2020 at the First Pentecostal Church in Asheboro. There were 6 participants, and unfortunately in March, due to COVID, that class had to be canceled. So still in Objective 2, Strategy 5-2B is the Safe Kid Program grants. Annually, we do receive funding from Safe Kids program. We received 24 helmets from the North Carolina Department of Transportation in April of 2020. We got $400 in June of 2020 for Operation Medicine Drop. We got another $400 in July for Safe Kids Day. And Safe Kids Day, basically, it was more of a social media thing instead of meeting in person. We didn't do any of these events in person. $400 we received in November for October's Fire Prevention Month. And then in 2021 of July, we received $1,200 for another social media campaign. And that's it for the update for the strategic plan. Do y'all have any questions? Okay, thank you.
Thank you. Thank you.
Oh, wait, I do have a question.
Okay.
You said that you did this first class and then it was canceled. Will that be resumed now, or will you look at doing anything online?
Now that we have Melissa on board, who's our diabetes, part of the diabetes program she's looking into creating with those partners would include a minority diabetes prevention program. So yes, ma'am. We did not receive any funding for 2021, but we still do have the incentives that we received or purchased for 2020. So it should, and she's actually gonna look into doing it more of a virtual class than an in-person class if at all possible. Okay, thank you.
Anybody else? Thank you, Wendy. And next on the agenda is Tara Aker with the fiscal year 2020-2021 bad debt write-off. And then that'll be followed by the health director's report.
Good evening, everybody. Y'all hear me okay? I can hear myself, so hopefully I'm good. So in your packet, you should have a bad debt write-off document and a debt set-off document. So we'll start with the debt set-off document, which looks like this. When we have a client who has not made a payment, we give them 60 days. And then this is just kind of an FYI, and that it'll lead into the debt set-off. At 60 days, at the 61st day, we send that client, and this is for a debt for more than $50. We send them a letter and say, please make a payment. This is what you owe. Please make a payment within 30 days. And if you don't make a payment within 30 days, we're going to send that debt to North Carolina Debt Set-Off, which is a clearinghouse, which can garnish and get payment through a North Carolina tax return that's over $600, or via lottery, the North Carolina Education Lottery winnings. So in fiscal year 2020-21, what is currently at in, I'm looking at the wrong one. What is currently in the North Carolina Debt Set-Off Clearinghouse, you'll see at the top of that document, is $180,000. That's what we're trying to recoup through NC Debt Set-Off. In fiscal year, if you go down to the bottom of the page, in fiscal year 2020-21, we were able to get payment for $14,880.41. So we were able to get a little bit. And if you look at how Darlene Hill, our finance director, has it listed on this document, you'll see we began debt set-off in 2010, 2011, and you can see that incrementally throughout the years we've been able to get more and more payments through NC Debt Set-Off. So when we have an inactive account where a client has been inactive for more than 4 years and they have a balance of less than $50, we pursue writing that debt off. In these situations, clients have to meet certain criteria where we just absolutely think we're not going to be able to get that payment, like someone who has died, or somebody that's a confidential client, and a confidential client means we can't send a bill to their address. They've opted to be confidential. That could be a minor or something like that that has opted to be confidential, and we can't send a bill to the parent's house. It could be we don't have a social security number on file for that client, or it could be somebody that's filed for bankruptcy and we just know we're not going to get payment. So in those situations where it is $50 or less, we bring that to you all and ask that you all approve that we write off that debt amount. So for last fiscal year, we are requesting that you all approve the write-off for $4,383.20.
Here, I just have a question about
Sure.
that. If you don't write a debt off, what does the department continue to do to try to collect it? I'm just curious.
Brooke, you may have to help me with that. I don't even want to guess. You do more of the finance piece. Can you help me answer that question?
It's my understanding that as far as to continue to collect, that they send the notices up until we follow the policy, the bad debt delinquent accounts policy. Help me remember, do you have that policy?
I do.
I'm sorry. I think that we continue to send out statements and request that the accounts be collected, and multiple attempts, with phone calls, statements, until it's determined that it cannot be written, it cannot be collected. Yeah, I'm sorry.
Ask that question again, Alan, please.
When debt is not paid, I was just curious as to, after many months of trying to collect it, what you do before you write it off to continue to try to collect it. Does it go to some other level, or what happens?
It doesn't. I think what Brooke said is the continual reminder to get payment But, I mean, it takes 4 years for us to take any kind of action, and that means that we're not getting any kind of response at all. I mean, there's no activity. These folks are not coming in. We haven't seen hide nor hair of them. They've not made any effort to come back for services, not made any effort to make a payment. It's as if they've dropped off the planet.
That 4 years answered my question.
Okay.
Any other questions on the board? If not, do I hear a motion to approve the fiscal year 2020, 2021 bad debt write-off as presented?
So moved.
I have a motion from Amy. Do I hear a second?
Second.
Brian? Thank you. All right. All in favor signify by stating aye.
Aye.
Opposed? Motion carries. Thank you.
Is
Next,
there any payment made at time of service for, to try to avoid the debt? So,
We try, I mean, if they have money to pay, yes, but, we can't refuse anybody's services. We can't they can't be a barrier to service if they can't pay. And, we encourage people, come in and pay what you can, work out some type of a payment plan, $5 here, $10 there. We're real flexible in how we get payment, because we know it's hard for some people.
Tara, before I forget and before we get too deep into your report, will you introduce your staff that's with you
Yeah,
tonight?
that's
Okay.
what I was going
You
to
may
do.
have already been going
Yeah,
through that. All right.
it's next on my list.
Okay, good.
So moving into the health director's report, I do want to recognize, y'all know most of the team here. I do want to recognize, I announced at the last meeting that we had a new assistant health director. Well, she joined our team on August the 2nd. I think most of you have already met her. It's Jennifer Layton. Jennifer comes to us. She has an undergraduate degree from Wingate University in history, a BA in history, and she has a master's in science and public health from UNC Charlotte. We shamelessly stole her. We like to steal people who are trained and good public health employees. We stole her from Stanley County Health Department. And she comes to us with a wealth of experience and knowledge. She's real strong in the health education she has huge background in public health education. She is doing a phenomenal job with the health education team. She has preparedness experience. She has some accreditation experience. She has quality assurance, quality improvement experience. She has experience in overseeing a pretty significant, was it $1 million or more? $1 million grant related to the opioid epidemic. So it goes without saying that she's going to lead our opioid epidemic, our collaborative, when we reinitiate that later this month. So without further ado, this is Jennifer Layton. So we are happy to have her. You all know Amaris, you all know Wendy, and then we have Laura Pinion. Laura Pinion is a WIC nutritionist that joined our team. How long has it been, Laura? July 1st. Laura has previous WIC experience, and I think she has just kind of jumped right in, hit the ground running. And she's seeing clients left and right. So we're happy to have her too. All right. So for the actually a communicable disease update. I'm going to start with that under the health director's report. So of course we're going to start off with the latest COVID-19 information. As of today, since March 23rd of 2020, we are up to 18,765 positive cases. We've been dealing with this surge for the last month and a half related to the Delta variant. And it has brought significant increases in the last 6 to 7 weeks. Around the time we met in July, we were seeing 20 to 30 new cases a week. Now we're seeing 500 to 600 new cases a week. And last week we had an average of at least 75 new cases a day. At our July 12th meeting, we reported 232 deaths. We're 2 months out from that. As of the end of the day today, we're at 274 deaths. So we've had 42 deaths in 2 months. And I will say, I don't know all of the ages, but the ages span from young to old. So we've had people in their 40s die in the last couple of weeks. So it's just a reminder that it is not a respecter of person, age, any of that. So it's still very important that folks consider getting the vaccine. In July, we reported 0 outbreaks in congregate living settings. Today, I'm reporting that we have 8 outbreaks in long-term care facilities and 1 in the Randolph County Detention Center. All of those facilities are working hard to keep those under wraps. I have to give props to the Randolph County Detention Center. They have worked tirelessly to keep that outbreak contained to a certain area of the detention center. If you guys will cross your fingers, say a prayer, we need to go 1 more week with no positives or no symptoms to get out of this outbreak. It takes 28 days to get out of an outbreak, so we've got 1 more week to go. So let's hope and pray they can get that out of there. They are still diligently working to test every inmate or detainee that comes into that facility, and they are separating those inmates until they know a test result. They're usually trying to quarantine those folks for 14 days just so they do not introduce COVID into the general population, because there are positives that come in. As long as they come in and stay out of the general population, those positives are not part of the outbreak. Of course, with increase in numbers comes an increase in the demand for testing. I don't know if you've passed by RCC in Asheboro on a Monday, Wednesday, or Friday afternoon, but the line for testing is tremendous. Friday before last, they had 70 cars in line waiting to be tested. That's large in part because of the Delta variant, but also because of the governor requiring a lot of his unvaccinated state employees to get weekly testing. To accommodate that increase in testing, StarMed has increased their hours at RCC here in Asheboro by an hour on Monday, Wednesday, Friday. So they're doing 3 to 7 on Monday, Wednesday, Friday here in Asheboro. They continue with Tuesdays and Thursdays in Archdale, RCC from 11 to 2. We're also trying to help offset that demand. Starting this morning, we began offering drive-through testing by appointment at the health department to try to lessen that load and give folks a little more opportunity for a different time of day to get testing that may be more suitable for them. We'll see how long we can maintain that. If the booster doses become available for the general population, our focus may have to shift back to more vaccine. But we'll see. We'll do the testing as long as we can.
Hey, Tara, how many people in the county have been vaccinated?
We are at, as of end of day on Friday, hang on, that's public health. Countywide, at end of day today, 57,385, or 40% of Randolph County residents have had a first dose of vaccine, and 52,078, or 36%, are fully vaccinated. Since you asked that, I'll go ahead and say at Randolph County Public Health, at the end of the day on Friday, we have administered 16,702 first doses, 15,466 second doses, and we've been doing third doses, that additional dose for the immunocompromised, for about 3 weeks now, and we've done 207 of those at the health department. So that's all numbers combined. We've done 32,375 at Randolph County Public Health.
So the two numbers are different. It's 52,000 with 2 vaccines or both injections, and 57,000 with just 1, correct?
Correct.
Okay.
Yep. I also want to point out, I'll just quickly add, we were talking about the testing that StarMed's providing, the testing that we're providing. Both StarMed and us, we're doing no-cost testing. So just for the public to know, those are no testing events. We charge nothing at all. StarMed, if you have insurance, they may bill your insurance for an administration fee. But I also want to point out the Horizon Internal Medicine, for anybody that's listening that's uninsured or underinsured, they can go to Horizon Internal Medicine for a test as well. And of course, there's providers all throughout, urgent cares, other providers that are doing testing, but you have to have an appointment and you're probably going to be charged a fee.
I have a question.
Yes, ma'am.
So that's over 64% that has not been tested, over 50% has not gotten vaccinated. So what is your initiative or drive to get the other 50% of Randolph County back? What's the holdup?
It's been a challenge, you know, there's a lot of misinformation out there, and unfortunately, there's you know, people aren't buying into the need for vaccine. You know, we've tried all sorts of things. You know, we've taken it into the communities that may not have access to get to the health department. We've participated in the summer cash card program. That we started that in early August. In June and July, we were only seeing about 50 or 60 people a week for first doses. I mean, numbers had gotten that low. When we started the summer cash card program, we were given 150 to 200 first dose vaccines. So we think between the Delta variant, the concern about the Delta variant, and that summer cash card, that drove up the increase in vaccine interest. We wrapped up that summer cash card program on Thursday of last week. We had cards through Thursday of last week. We had 5,050 $25 cash cards. And let me back up. I don't know if you all know what the summer cash card program is. When we started, it was if you came and got a first dose of vaccine, you would get a $25 summer cash card. This was a DHHS in this initiative. And if somebody drove you, the transporter would get a $25 cash card. So we got all these $25 cash cards. It was just like a Visa or MasterCard that you could use as a credit card. The day before we were to start, the state changed it to fall in line with what the federal government was saying, which was $100 per first dose, $25 for transporters. So when it was all said and done, we were able to distribute 5,050 $25 gift cards. So that totals somewhere around 1,159 first doses and 403 transporters. There were somewhere between 6 and 10 cards that didn't work, so I can't count those in what was distributed. So we didn't have trouble getting rid of those. That program ended, and I do believe the state will initiate another incentive program that will not involve us as far as us manually, because we had to pull in environmental health, other folks to help get those cash cards. Because of course, there's a lot of inventory and controls with all those cash cards, because when you do the math, that's a lot of money in cash cards. But I do believe they will do some type of an incentive program that will involve us. We give the vaccine, we may give the first dose and the transporter some type of a handout, a card, or a piece of paper that says, here, go online and you can redeem your cash card this way. But details about that are yet to come. Did that answer your question?
What is the narrative that's out, and how can we change the narrative so 64% of our county can be tested, can have the
Vaccinated?
or wear a mask?
You know, we're going to get to that in a little bit.
Because I'm not understanding either one of them right now.
No, they're not. I don't know if you saw the Board of Education meeting that I was at a couple of weeks ago for Randolph County Schools. You know, I was sharing the facts, the information. People don't want to hear it. They've made their mind up. You can put the facts out there, but people have already read what they want to read on social media, done the research, listened to a friend. They've made up their minds. We have put education out there. We have done everything in our power to try to get the right information out there. For whatever reason, people are going to believe what they want to believe. A little later on, though, in your packet, there's a sample letter that a Board of Health from Henderson County put out that supports vaccine. The Board of Health says this: we encourage you to get vaccinated. The Board of Health encourages you to wear a mask. And I'm going to ask if you all want to, and we can talk about it now if you want to talk about it now. I don't know if you guys...
Hey, I need to, just to clarify the numbers, so 57,000 have had both vaccines, 52,000 have only had one.
First dose is the 57,385. They've had one dose of a
Okay.
2-dose series. And then the 52,000 is they've gotten both.
So that's still a portion of that 57,000 number?
Correct.
Okay.
Yes.
Because I'm thinking, well, that's 100,000 people, and we got 140 in the county. That's pretty good.
Wishful thinking.
That's 64%. That's
Now, keep in mind, these numbers are coming from the state. These numbers don't factor in that 12 to 15% of our population are too young to get vaccinated. They're not eligible yet. So keep that in mind when you look at those numbers.
Tara, has it made any difference, the requirement of the long-term care facility staff getting vaccinated? Do you get any type of report on if they're getting vaccinated?
See, that's long-term care facilities that receive government funding.
Yes,
Is that not most of them?
not all.
Really?
It's not class, it's not.
Because I know there's long-term care facilities that have staff that are not vaccinated.
Okay.
And with these outbreaks, the ones I'm familiar with, every single time, it has been an employee that brought it in.
A lot of times it is. I've asked our CCTC folks. Those are the folks that are embedded in the health department. They're the ones who've been helping us with case management, contact tracing since last. They've been with us for over a year now. When we have the outbreaks in the long-term care, I ask them, I want to know what the vaccine status is of who's positive. And right now we're seeing a mix of actually both. Residents that are vaccinated, staff that are vaccinated, residents that are not vaccinated, staff that are not vaccinated. It's about 50-50 that are positive. I have found that interesting because I really thought that it would be more not vaccinated. But yes, you're right. A lot of times it is staff bringing it in from the outside.
And sometimes I've been told that when they take a resident out to the hospital and they come back and they test them, that they will test positive. Even if they've been vaccinated, they will test positive. But then sometimes a retest will be negative.
I'd have to know more about what kind of test they're doing, a rapid versus
I
a
don't know.
PCR.
I don't know. But per this, the whole masking, vaccines, whatever, I just think it's important for our narrative to focus on take it seriously, take care of yourself, take care of others. I got an article today. It's on an ABC affiliate in, I think, somewhere in Alabama. But a man who was in his early 70s, he thought he was healthy, but obviously not because he had a heart attack. And they called hospitals in 4 states. About 40 hospitals did not find anybody to take him, and he died. So that will be here. They are already facing that.
They are. And I know Randolph Health, I've communicated with Dr. West. I mean, Julie, you can speak to it. They're covered up. They're doing all they can do.
So people need to understand it's not just about COVID, it's about COVID using up all your facilities, which is what public health has known since the get-go. But it's about it eating up all your facilities, all your workers, everything, so that then those people with other health emergencies,
Yes.
can't get any service.
And that's been my communication with the hospitals. They have folks tying up the ED that are COVID positive, and there's nowhere for them to go in the hospital because all the beds are full.
Well, the other thing is you have to have enough staff to take care
Sure.
of them, and I read this big narrative on Facebook today, which just frustrated me. But anyway, the other thing you don't think about is when you have a patient that is extremely ill in PCU, where you normally can have a 1-to-5 nurse ratio, now you have a lower ratio, or else those patients that are getting the high flow oxygen and such cannot get the care they need. So staffing numbers, yes, we need more staff. But 2, when you're having to reduce that ratio, then you don't even have enough staff to be able to fill the rest of those beds. And it's a lot worse than people think.
Yeah.
And it's, like I said, I read the narrative through Facebook today that Randolph Health had put that the ICU was full, or I think it was Fox 8. But there's a lot to it, but there's so much misinformation and so much thought that is not accurate,
Well, and,
far from accurate.
you know, it was politicized back in the beginning, and that has been a big part of the problem in the decisions that a lot of people have made not to get vaccinated. So back to, if y'all want to look at that letter that's in your, to help address and encourage folks to get vaccinated, Courtney, there's a letter from the Henderson County Board of Health that they put together and shared with the community, encouraging folks to make the right decisions, make good choices.
It's like, how could we reach out to the political parties, because those are the ones that are running the narrative? So how can, when I passed down the street earlier when I was coming in, I saw the Republican headquarters, and then I saw Joe Biden, the Democrat headquarters. How can you sit down and speak to the leaders of those organizations to put the narrative? Because they run the show a lot, especially in Randolph County, with the decisions that our, I guess, our residents are making. And it seems like that could be something that you guys could address.
Well, we've got Hope that's on the county commissioners, and she shares, and we give updates to the county commissioners weekly via email. So the information is out there.
She has more than I do.
You said we have hope.
So I mean, you know, I mean, we could think about having a conversation with those individuals. I just think that the leaders that be, like our county commissioners, are our biggest proponents for sending that message, because they're the folks that people hear the loudest.
But they're not, 64% are not listening, Hope, so maybe we
Oh, I know.
yell a little louder.
So
No,
I
if-
have a suggestion.
Sure.
As a general rule, Americans do not trust the government. And I think that can be broadly stated, no matter your party affiliation. What if you had medical leaders in the community that would come out and say, hey, this is what we're seeing in Randolph Hospital. This is what is happening in the county where you live in. This is what you need to do. People that don't necessarily have a political dog in the fight.
Folks that are respected
Yes.
and people are going to
Yeah.
listen to.
So, you know, if Dr. Leninger told me, hey, this is what I'm seeing in the OR, then I'm like, well, that's what he's seeing in the OR because
Sure.
he's there.
Sure.
Whereas if it comes from an elected official or a politician, it's going to tend not to be trusted, even by myself.
Right. And I like that idea. I know when we did the Bring Summer Back campaign, we tried to find folks that people thought well of. For example, Dr. Shackelford from RCC. He's well thought of throughout the community. And our team interviewed him and said, explain to us why you got the vaccine. And we put that on our social media site. So yeah, we can pursue doing something like that.
I do think that, Ryan, that's a good point. I just heard a story over the weekend. Fella had been debating about what to do, you know, and he'd been hearing everything that's on social media and wherever. But he said, you know, if you get down to it, if I'm going to build a house, I'm going to consult with a builder. If I'm going to get a loan for that house, I'm going to consult with a banker. So why am I not consulting with my doctors, and why am I not consulting with my pharmacist to figure out if this is not the right thing for me? That individual talked to those people and then made the decision, you know, to get vaccinated. So I like your idea. Certainly get some of those people together, and maybe we can put it through social media, whatever we need to do to put it out. I don't know if this board's got any clout. I don't know that we would have the same result as a well-respected doctor
Sure.
in this area.
And people like numbers. I like to know, well, how many people have had it? How many people have survived? What are my odds?
Yeah.
How many people are in the hospital? How many beds are available? People, and myself included, I want to know, you know, so I can make an educated decision.
Sure.
And ultimately, it boils down to a personal health decision. I mean, I don't want to tell you what to do with your health, and you don't want to tell me. But like Marty said, if it comes from a healthcare provider, then you're more inclined to trust that individual and go on that recommendation.
No, I like that idea. Health Ed, are y'all listening? We have money we can spend.
I also think part of what's missing is the fact that in the arguing about it, then we lose the masses.
We do.
We lose them in that, so that it becomes divisive, and so they don't take the risk, the disease, the things that it can do to you, to the people that you care about. They don't take that seriously because there is all there's arguing, and so they go chasing rabbits in those arguments, and we lose them on the seriousness of this disease and what it's doing, not just in terms of what the disease does to the person who has it, but, you know, what does it do to families? What does it do to the healthcare system? What does it do to everybody involved? You talk about in Union County, they're looking at totally ignoring any kind of
The mask mandate.
guidance at all in the schools, So, to me, there's that lack of understanding that the issue, yeah, children are safer, but for the first time, it is impacting children, and for the second part of that, children who do fine with it bring it home to adults who don't. So, and then and maybe those adults do okay with it after a stay in the ER. But then there again, you're just cramming all those people into your healthcare system, which is going to collapse.
I think it boils down to distrust. I mean, people don't trust the vaccine, people don't trust the news, people don't trust the media that's out there. So I think if it came from someone local, a face that people knew, and it was real numbers based on what the county is experiencing and what we foresee could happen if we don't change the course.
Yeah, I like that.
Right, and I want to say one more thing, and then I know you want to speak, Mary Ann, but I just got to get this out there. We need pharmacists.
Yeah, and did we do a
Because
pharmacist?
pharmacists used to be,
Ashley Duggins?
they used to be the number one trusted profession in the country. They used to do, we won't tell you where attorneys were. But, I mean, pharmacists were the number one trusted profession. So for people that see the pharmacists that they know and trust, those community pharmacists,
And
then.
we need to go back down that road. We did, I think Ashley Duggins, we interviewed, but it's been a little while since we've circulated those videos. So yeah, we can definitely go back down
Yeah,
that.
but we need to get, a lot of you guys.
Even Mary Ann.
Yeah. I like Ryan's idea or Tara's idea of the influencers in the community, but I don't think it has to be an either or. I think what Courtney is speaking to about getting the political leaders involved is trying to, and correct me if I'm misunderstanding you, I think she's speaking to trying to influence those influencers and getting them to understand and speak to their followers and maybe get them to understand so that they can get their followers to understand. And I don't think it has to be the political people or the educators, the doctors, the pharmacists. We can address all of the above.
I agree.
A suggestion to a solution to
No, and I appreciate it, Courtney, I do, because we're at a loss, because we want people to get vaccinated. If anybody wants to be over and done with this, it's us. We're ready to get back to.
So I'm going to give you maybe a bright spot in all of this. Just crunching numbers in my head. If 57,000 have received the vaccine, if we'll say approximately 20,000 have tested positive, and 15% of 150 is what, another 25,000 that aren't vaccinable because they're too young, we're over 60%. Because the ones that tested positive have antibodies, which is the same thing the vaccine is doing.
Just hasn't been determined how long those antibodies last for.
Over 2 years, recent research said. We don't know how long the antibodies for the vaccine last either.
No, we're starting to see them wane, though.
Yeah,
Well,
sure.
actually, my son and I both are part of a study at Wake Forest. He had COVID. His antibodies from COVID, because he was testing as part of this study, he had COVID in March, and his antibodies from COVID were gone by September. Gone.
And we have a public health team member
I
that's.
have to wonder if
Yeah.
if that's so variable, given your exposure, your viral load.
We had a public health team member that was positive in late December, January, and it was the same way. She was tested, her antibodies were tested, and they were slim to none a month or so ago.
I was positive 6 weeks ago, and I had an antibody test done to see the quantity.
Sure.
And I'm going to measure it over time and see what it is.
Good.
Keep us posted on that.
Yeah.
Because that's, I think that's very interesting.
Well, all of those numbers are interesting, and I love statistics as much as anybody does, but the basic problem Hope has pointed out is that the medical system is going to be overwhelmed. In the business I'm in, I deal with a lot of physicians just in the nature of what I do every day, and I have friends I went to school with who are surgeons, and one teaches epidemiology at one of the big medical schools, and they're terrified by this. And one of them's hospital is closed to new admittees now. And we in America take for granted that when we get sick, we're going to go to the hospital and we're going to get treated. That's going to stop happening. It's just going to stop happening because they're full up.
They are, and I've had a conversation in the last couple of weeks with emergency services, and they've shared that they're having trouble sometimes finding a hospital that'll take somebody. They'll show up at a hospital or call ahead, and they're diverted somewhere else because
Even in North Carolina.
even here, it's not just Randolph Hospital. It's they go to other hospitals and they're being sent other places because they just can't take them.
And to me, that's the most frightening part of this whole epidemic, because I do what I can to stay away from it myself, and have been successful so far, but anything can happen to anybody.
Absolutely.
Anybody can have a heart attack at any age, or a diabetic episode at any age, and you come down with a diabetic attack when you're 40 years old and can't find a hospital bed, and you're dead. And I don't know how to get this across to people, but it seems to me that's the message the population needs to hear. And that is so not political. That's just, there's not enough resource to take care of sick people if we keep feeding more and more and more sick people into the system. And it's a fact that there are more sick people in the hospital now than there have been, or the hospitals wouldn't be full. So that doesn't need to be reduced to some sort of statistical analysis. That's just the way it is. That's there for anybody to see. Go up to Cone and take a look. And I'm just completely befuddled with how to get that message across.
Yeah, we are too. But I'm thank you for bringing that up, Courtney. We will take some of these ideas and put them into action. But that brings me back. Go ahead.
I think that, as he had said also, but communication, and how do you get it out there? I've been watching on TV the Cone report of the percentage that are vaccinated and the percentage not in the hospital and ICU and ventilated. But then someone that I know dearly had never seen that on the TV. I'm like, it's constantly on the TV. I'm seeing it all the time.
Or social media.
And I'm seeing it.
Yeah, social media, yeah.
But this person is not seeing it, whether they tune out it's just, the question is, how do you communicate it? How do you make it where people truly hear it? And newspapers are not the way anymore, and mail's probably not the way, and social media, but then there's a lot that's not on Facebook. It's just like, how? And that's, to me, I wish there was an answer, but there's not.
I agree with you. I do too.
I do wish that the state would look at or consider, when they're giving those percentages out, the populations in those counties that don't qualify for a vaccine, and that's right now the younger children. because that skews your numbers. And so you're talking about trust. I think that's where some of that mistrust comes from. When they see 36%, that looks horrible for a county, but how many in Randolph County fall in that age bracket that don't even qualify?
Absolutely.
Do we know those numbers? How many children we have
It would be the,
under 16?
yeah,
If it's 15%.
it's 12 to 15%. I don't know exactly.
Okay.
You're probably 20.
Because when you look at like
Okay.
census data, I mean, it breaks it down. It doesn't do like a 0 to 12. It does 0 to 17 or something like that. So I don't know exact numbers.
Okay.
No, but it does, and that came up at that board meeting a couple of weeks ago, that, you know, people don't trust that information coming from the state because it does exclude, or it doesn't break out that group that's not eligible
They
yet.
don't trust it because it's not trustworthy.
Sure, I understand.
Yeah.
And I think it's important to get, as you said, have conversations with leaders in different positions, whether they're leaders in a business, whether they're an organization, if they're leaders of the faith community. And it's not about mandates. It's about doing what's right out of respect for other people. So it's not about making somebody wear a mask. I went to a church 2 weeks ago out of town, and there was no sign that I saw anywhere about wearing a mask. I walk in, the only unmasked people in the congregation were the smallest children. I mean, the people were singing, they were worshiping, their hands were raised in worship. It was such, I mean, it didn't, the mask didn't interfere with anything. And what it said to me is, this is a congregation that cares about people. So they're not mandating do this or don't do this, but there is that concern for other people and that knowledge that if this helps others, we're going to do this. So, like I said, there was not even a sign asking anybody to wear one. And yet, that's what they were doing. And before anybody asked, it was a Baptist church. Okay? I know that's going to be in your mind. I'll just go ahead and put it out there. It was a Baptist church. So, I think our message needs to focus on personal safety and concern for yourself and for others.
It is. I don't know if
making the choice that's best for you, but that choice that will protect.
Yes.
You know, you're doing your part to help take care of others and to keep our hospitals open and, you know, all those kinds of things.
Yeah.
And in Randolph County, the whole hospital issue is particularly important because we've had this problem with our hospital recently and the financial problems. And that, again, I don't know how to get this out, so maybe I'm just venting, but it's a more acute situation here than it is in a lot of places, and we've managed to hang on so far. We've still got a hospital, but once this wave of everything gets through, and I don't know, maybe there'll be another wave after this one, after this crest. Maybe another one, maybe two more,
Maybe.
I don't know.
We're hoping not.
Yeah, nobody knows.
No.
But my point in saying that is nobody knows what's going to happen to the hospitals that are here once this is through and these bills are not paid.
Right.
I saw the other day the average cost of care, this is anecdotal, I don't know for sure, but the average cost of care for somebody who goes in is about $17,000. And that's if they don't really get involved.
Sure.
If they don't really get involved in some more serious treatment. And if you do get involved in it, you get way up in the hundreds of thousands very quickly. And a lot of those bills are not going to get paid, and how's the hospital going to stay in
Sure.
business?
So
Good
to the
points.
letter, was the consideration to send this to everyone in the county? Was that?
It was to get your feedback on whether or not you as a board would like to put together something similar to this to share with the community.
So if we're looking at a way to reach people and we're going to send everyone in the county a letter, why don't we put a website or where they can log on and see a recorded message from somebody that's local here?
We could do that.
Did we find out how Henderson got this information out to their
I
residents?
think social media primarily.
Social media, okay.
But, we could send it to the paper. We could do mailers. And we've got some funding that we could do mailers.
I was just thinking if we're going to take the time to try to distribute it.
We could do it multiple ways. We could do mailers, we could do social media, we could put it in the paper. We do have some funds that could be used for something like this. If y'all are interested in sending out something like this.
I think any information you can get out is good information. Any request you can make to get people to try to protect each other
Okay.
is a good thing to do. But I would add to that, you're going to be the one signing it, it would look like.
It would come from the board. It would come from the board. The person that signed off on that one happened to be the physician member of the board, and that person was the board chair of that particular Board of Health. So it would be from you all.
Okay. I was asking that out of consideration for you.
Thank you.
So, follow up on this discussion in this letter, reading through it, is there anything in here that the board is not comfortable in basically signing off on, I guess is my question. Some of this is particular to Henderson County, but
The paragraph that starts with first, if you have not been vaccinated, et cetera, about halfway down the page ends in the sentence, we respect, ... If I was writing the letter, I would not include that sentence.
Which sentence?
The last sentence.
The last sentence of that paragraph.
it starts with first.
So you're saying we don't respect their opinion if they choose not to get vaccinated?
I'm not saying that.
I would maybe phrase it, we're encouraging you to get vaccinated and speak with your healthcare professional. I don't know. I would have to think about it. I don't think it's something that I can decide on a whim.
I think
Yeah.
that sentence alone weakens the statement a little bit, just as it's written.
Yeah,
So I would agree with you.
Yeah,
but
it kind of undermines the whole paragraph.
So Tara, could your staff put together a draft and hit on some of the things that we've talked about tonight?
Okay.
Consult with your healthcare provider, consult with your a trusted pharmacist, a trusted healthcare provider, things like that. Are there other things that you guys see, or?
I would think it would be nice if it contained something alluding to what Hope said about do it for others, do it for your loved ones, not just for yourself. That might,
Can I just make the comment, generally, we try to do things on a sixth grade level. This is very long and wordy.
We can do that.
And not sixth grade level.
Yeah. And our
I
folks
think a
are,
lot more simplicity to it.
yeah, and our folks are trained to.
Didn't you hear me say I needed more time?
There's a lot of people that are not,
Yeah, we
they're
can,
just gonna,
our folks are pros at making it so that it's readable by everybody. So yeah, we can do that. So we can draft something and send it to you guys
You're
to
right,
look
we
at.
won't read it all. We'll read the first paragraph. Good point, or two.
And y'all provide feedback, and we'll put something final together. And in the meantime, we'll work on what you suggested about putting a link, or you put a link in there to a video, or I can't remember who.
I don't want to take his credit.
All right, so yeah, we'll work on that. So you all are all on board with us going this direction?
Yes.
Okay. All right, thank you. Are we all good on that for now? Okay.
Okay.
I do want to mention to you briefly that I had a call from, some of you may know, Dawn Scotton Cavness. She's a Randolph County resident. Her dad was Dr. Scotton, the veterinarian at Eastern Randolph. Dawn is a physician, and she works for Atrium in Cabarrus County, I believe. She's working on a project that is working on getting farmers and their farm workers vaccinated. Now, we've had some success at getting some migrant farm workers vaccinated, but it's hard to get them to our clinic, and it's hard for us to get out there because their work days are from sun up to sundown. So Dawn offered for her team to, if she can get interest, to come to Randolph County and reach those individuals. So I wasn't going to say no. If she's got the resources and the folks to do it, we're helping her disseminate the information to these farmers. So I just wanted to share that with y'all, that we have that resource. Her heart is here in Randolph County. So we actually went to school together. So it was good to hear from her, and good to hear that she was offering that service to our farmers in Randolph County.
Well, I think that's a great idea. A lot of people in Randolph don't know that we have the biggest dairy in the state here. And I don't know how many employees they have, but it's more than 50 or so. And I know from talking to one of the guys who runs it that there's been a lot of, I wouldn't say hesitancy, but just a lot of not getting vaccinated.
Yes. And I think it's a perk that she's from Randolph County. A lot of folks know and respected her dad, so she may get buy-in a little better than, they may be more likely to accept it from her than they would from us. So
And if you get one of those guys up there, you might get two or
yes,
three of the
absolutely.
family.
So I will keep y'all posted on that.
As you mentioned that, this is just a thought, has there been any conversation about setting up a vaccine booth at the Fall Festival?
Actually, I've asked our environmental health folks to send Jennifer contact names and numbers for all of our event organizers so that we can reach out and say, hey, are y'all interested? Can we come? Or can StarMed come and set up vaccine?
So is that a go for this year?
We're working on it.
No, the Fall Festival, I'm sorry.
Yes, as far as I know, yes.
Okay.
It's on the Heart of North Carolina, their website. That one's on there. The Liberty Antiques Festival's a go. Willie's is not. NASCAR Days is a go.
Okay.
Help me, Jennifer. I think Seagrove is canceled.
There's, the one at Bush Hill is different. They
It
have
is
different
different.
sponsors, but
It's a little later than normal.
It is,
It's in,
but
I think most of them are in October this year.
it is a go in an abbreviated format.
So we're going to reach out to those event organizers and ask if we can come. And the Ramsar Fall Festival, I think, is still a go. So we're going to reach out to all those. So I'm sure you all have been hearing on the news about this booster dose that's coming. What we know at this point is that Pfizer has submitted a booster packet for FDA to review and consider for authorization. That is going to be reviewed this Friday, so that they will determine whether or not they're going to approve a third dose booster for the general population that have already received a 2-dose series of an mRNA vaccine. But this one right now is specifically Pfizer. Moderna has not yet submitted their booster packet, and J&J, there's not enough data yet to even consider if there's going to be a booster. There probably will be at some point down the road, but they're not there yet. So we should know more Friday or maybe by early next week, because once FDA authorizes CDC and the ACIP, the Advisory Council on Immunizations, will have to review that and give their recommendations. So once they do that, we'll know if there's going to be boosters available in the very near future for the general population. So of course we will let everybody know once we know something. Any questions about that? I'll just quickly give an update on the schools. I'm sure you all are aware that our largest school systems in Randolph County, URI Charter, Ashboro City, and Randolph County Schools are all following the Strong Schools NC Public Health Toolkit as it relates to everybody wearing masks. I will tell you, in the time that URI Charter and Randolph County Schools adopted the universal masking, we have seen the number of positives and the numbers of students and staff that are being sent home to quarantine. Those numbers have declined. The big thing about the universal masking is that when it's done hand in hand with other prevention measures like hand washing, good respiratory hygiene, vaccine, when students and teachers wear masks, when students come together, if there's a properly masked student that exposes a properly masked student, then the exposed student doesn't have to go home for quarantine. That does not apply to adults, but that was one big plus to adopting that face covering requirement. I'm going to give you an example for URI Charter. URI Charter has about 820 students enrolled, elementary through high school. Before they adopted the universal masking, they had 36 positive cases, which is about 2% of their entire population, but they sent home nearly 260 students. Since they've adopted the universal masking, last week they had 8 cases and they only sent home 32 folks for quarantine. So if that shows you anything. And let me give you an example of Randolph County Schools, because their numbers are huge. So it's got, Marty, correct me if I'm wrong, 15,005 students.
Yes.
Dr. Gainey sent me a chart. Now keep in mind, the masking does not apply to like extracurriculars or sporting, because they're breathing heavier in those environments. So a lot of times the kids that are getting sent home are related to athletics, and there's an exposure in athletics. Well, so, for example, the very first week of school, there were 81 total positive cases in Randolph County Schools. That's system-wide, staff and students. 41 of those cases they impacted the school. That means those kids were there or adults were there and they had an impact on school. So they probably sent somebody home. They probably meant somebody had to go home and quarantine. So from those numbers, the number of students that had to be quarantined that week were 530. Now, that doesn't count the 461 students or staff that were exposed outside of school. So that's what's 461 and 530 plus 81. I didn't do the math beforehand, but that tells you that was quite a number of students and staff that were sent home for being positive or being exposed at school or out in the community. So last week, while the number of positives was up, this is since they've adopted the universal face covering requirement for students and staff, they had 171 positives school system-wide. 120 of those cases impacted the schools, so they impacted somebody on campus. But it only sent 105 folks home, so that's a big difference. Now, that doesn't count the 806 that were exposed outside of school. So you see where folks are getting it. It's happening, the transmission is happening in the community. or the exposures are happening in the community, not typically in the school setting. So that's just an example. And Dr. Gainey did a little bit of math. Was math his background? Because I think
Yes, he's a high school math
he
teacher.
had fun doing this little
Oh, yeah.
chart. So based on the numbers from that first week, those positive cases, each case impacted on average 12.9 people. So he did some math, and based on last week's numbers, had that 12.9, had those positives impacted the 12.9 individuals, it would have sent home 1,548 people. So it's just to give you an idea of what the universal faith covering requirements are, how it's impacting keeping the kids in the classroom. So we're excited about that.
What's the rule for adults there? I don't understand the difference. I can't find in the school kit, the toolkit about, I know the recommendations for kids. Why is it different for adults?
It doesn't give an explanation. We speculated it's because kids don't transmit it as easily as adults do. That's our explanation.
And do they have to quarantine differently if they're a staff member or a teacher versus a student?
If a staff exposes a staff, or a staff exposes a student, or a student exposes a staff, the staff member has to quarantine for 10 days.
Regardless vaccination status?
Now, if they're vaccinated, as long as they remain symptom-free, they can continue with their normal activities. We do encourage them to get tested at 3 to 5 days after their exposure and to wear their mask for 14 days or until they get their negative test result. Yes, and we have continued to allow. Our rule of thumb is we've stayed with the CDC's 14-day quarantine for everybody except for schools and child care centers. We want kids in the classroom, but again, we see little transmission in the school settings. They're not school settings. Child care centers are not the super spreaders like other environments are. So we've left them at a 10-day quarantine. All right, I'm shifting gears. Are y'all good on COVID? Let's talk about hepatitis A. If y'all remember last meeting.
It's a much better topic.
I know, right? I told y'all last time that North Carolina has a hepatitis A outbreak, and Randolph County has an increase in cases. Fortunately, we've hung at 60. We haven't increased since we last met. And I explained last time that we had been proactive in trying to address that. We had put together goodie bags and disseminated those throughout the community. We were working to get hepatitis A vaccine into the detention center. We have been, even since then, we've been to the homeless shelter, we've been to Our Daily Bread, all for hepatitis A and COVID, actually, a COVID vaccine. But our efforts with hepatitis A, we've had to scale back a little bit because of our response to COVID. We've been delayed at getting vaccine into the detention center. First, due in part to the detention, I'm sure you're all aware that the detention center is undergoing, they just finished up their new addition. Now they're doing some renovations in the old part. The old part is where the new vaccine refrigerator was going to go. So it's been delayed getting that refrigerator in there. And then on top of it, we've got an outbreak, and we don't want anybody in the detention center that doesn't have to be in the detention center. But we will get back on that as soon as we are able. All right, y'all good on Hep A? All right, the flu. Right now, we're not seeing a whole lot of flu. A lot of primary care and other physicians' offices are doing a combination flu and COVID test when folks come in with symptoms, just to rule out one or the other, just as an FYI. And we will be getting, annually we usually only do flu vaccine for our public health staff because there's so many providers, pharmacies in the community that make it available. We don't want to compete. We want people to go to their primary care, to their trusted pharmacy to get their vaccine. But we will be doing vaccine for our staff, and I wanted to make the opportunity available to you all once flu vaccine is here. If there's any of you that want the vaccine, please let us know. We're happy to provide that for you all. Shifting once again to RSV. Since late spring, early summer, cases of RSV, which were pretty unheard of last year because of COVID and all the mask wearing and everybody staying at home, RSV has been on the rise. And again, just as an FYI, providers are testing. There's a test out there that can test kids, adults for RSV, flu, COVID all in one. So providers are doing that. We have seen some increased cases in child care centers, but they're handling that appropriately. Syphilis. we're seeing an increase in syphilis. Last fiscal year, we had a total of 9 cases. Last year at this time, we had 1 case, and so far this year, we've had 11. So,
People staying at home more.
I know, they need to get out.
Safer outside.
It is safer outside.
Stop there.
Yeah, that's all we'll say about that. And then last time I think I shared with you, we've got some individuals in the community that are getting latent TB infection treatment. We've got 2 folks that are currently getting LTBI treatment. And that just means that those individuals at some point have been exposed to TB, and we're giving them meds to keep it from remanifesting itself. So that's it for the communicable disease report. I'm going to shift to the health director's report.
What's happened to pertussis in the last 18, 20 months? I haven't heard of any whooping cough cases, really.
You know, a lot of those respiratory illnesses, you know, kind of subsided last year with everybody being home, wearing masks, and COVID being at the height of things.
So it's still
Same thing, you know,
low
it was
at
like
this
that
point?
with the flu, yes.
Yeah, okay.
Mm-hmm. Y'all ready to switch gears a little bit? Okay. So I've introduced Jennifer, I've introduced Laura. We've already taken care of the Board of Health letter position statement. I just want to quickly give you just a couple of updates, actually. If y'all remember Medicaid transformation, we went live with that in July, on July 1. Not being a provider of primary care, it does not impact us to the degree that it does a lot of health departments, but it still impacts us. It impacts our case management programs. It impacts, help me, Brooke, it impacts very few of our clinic services. Our dental clinic is excluded, and our family planning, Be Smart, is excluded.
Yeah, and the Medicaid Direct population is excluded.
Thank you.
Which are some of the family planning clients.
Thank you. So far, as with anytime you go live with something new that's brand new, there have been some hiccups. You know, we're working with, is it 5 prepaid health plans? 4?
4. Yeah,
4 prepaid health plans. So that means we have contracts with all of those entities. Some of the hiccups we've had, we've actually been delayed with one of our contracts. Brooke is doing a real good job of staying on these folks and communicating. We've actually had some delays in payments for our case management program from one prepaid health plan. And those are just some of the many issues. The state is aware, and they're proactively working to help work out some of these kinks. We expected some of this to happen, and we feel confident that these issues are going to resolve, given a little bit of time for everybody to get this under their belt a little bit. Next is our opioid collaborative. You know, I mentioned earlier that Jennifer has lots of experience with the opioid epidemic and substance use issues, so she is going to head up our opioid collaborative, and we're going to reinitiate the meeting of the collaborative. Our goal is to have our next meeting on Monday, September 27th at 2 o'clock, if any of you are able to attend. We have not yet decided if it will be an in-person meeting or a virtual, but we'll decide in the next week and let everybody know. So we're excited to get that back, because that's, you know, during the pandemic, that didn't slow down at all. If anything, it has gotten worse. So we need to get back on track with that. So, and we're excited to see what Jennifer's gonna bring with that. The last thing that I have is just to bring up to you all and get your input. Marty and Brooke and I have talked about going paperless so that y'all aren't getting, you know, a folder full of stuff that you are going to take home and may or may not do something with it. We've talked about the possibility of getting you all individual devices, like a small laptop. I don't know if that's something y'all are interested in having and keeping up with, where we could just send you the documents via the cloud, via your 365 email with the county, or if you would be okay with using your personal devices for us to do that. You know, we would like, if you if we provided you with a device, then you could come in here and connect, and when we're presenting, you can look at the documents as we go. And if you wanted to, like what you guys do, Hope, for a commissioners meeting, if you wanted to scroll and look at something specific,
So
you
here's the
could.
question for Michael. If they use personal devices and have it on personal device, will they be able to connect in here?
We have a guest wireless network that we can allow personal devices to attach to, or if it's for official use. We don't offer that to the general public.
Well, you've been holding out on me. It's the first I've heard of it.
Sorry, Michael.
It is available, but we don't focus on it.
Okay.
So I'm just planting that seed. Do you all have you don't have to answer me today. I mean, I can send an email if you want to think about it, or if you have an opinion tonight, either way. Don't want to overload you with stuff, but at the same time, I know I'm a paper person, so this doesn't bother me. But I understand that you may or may not want to take all of this home.
My reaction would be whatever's easiest for the health department. I mean, I can deal with whatever way your office needs to do it, whatever is most efficient and costs the least for you guys.
Okay. Anybody else of a? Okay.
Is that it?
Yeah, that's it.
Okay, any other comments or questions for Tara before she steps down? Okay, board members, real quick, I'll just mention that, it's hard to believe, but Tara's 6-month evaluation's coming up. So what I'll do is put together some information and send it out to you guys, and then just you'll look at it and give me some feedback. And then we'll get that turned in by, is it November 1?
November 30th.
November 30. But I'll go ahead and try to get ahead of the curve and get that back out to you. So just be on the lookout for an email from me on that. So any other things?
Okay, so let me put in a plug for, the Cooperative Extension is working with the, our broadband initiative in Randolph County. And so for people that don't know it, that's been a huge focus for county commissioners nationwide because people are not, their citizens don't have access. So you think, well, that's very remote areas. Well, sometimes it really isn't. And so I didn't find this out until Kenny Sharon started working with this. But apparently with the FCC, if an internet provider gets a tract, then that tract will be miles and miles in area. And if one person in that tract has internet access, then the provider can say legally they're providing internet access. Yeah. And so they, in essence, some are getting a lot of money for very, very, very poor service.
So back to you don't trust the government. Why would they write it that way?
Exactly. Well, there's an opportunity now to tackle that problem, and we need for people to fill out, in Randolph County, to fill out a survey. You don't have to fill it out by hand. You can go online to a website, or you can call a phone number and, and do it. You can text that number, you can call the number, or you can do it on the website. It doesn't take but just a few minutes. But it's, even if you're calling, like I know down New Hope Road, Church Road, they don't have good phone service either. And so a lot of those families have landlines still to use in their homes. You can use a landline and call the number, and then they will get the information from you. But that's the way for us to know, Randolph County to know accurately who has coverage and who doesn't. I was at the racetrack the other night, and they were scrambling because in the middle of everything, they don't have any internet, and so they have to use broadband, and they all of a sudden one of their towers or whatever is out, and so they're really working. So So obviously, I need to report that area of the county, so Ryan, that's where you are.
I don't have internet.
Well-
My kids can't even do online school at home.
Exactly, so,
Yeah.
so you are primed for that, and I'll give you that number when we finish. If anybody does social media, on my Hope for Randolph County page, I have that information in a post. I took a picture of the little card and put it there, but it's very, very important for people to take the time to complete that survey. I've done it. We need thousands of people to do that, so we'll know where the gaps in coverage are, because a large amount of money is coming down for that. And so we need to get our providers doing what they're supposed to do. And our citizens, in my opinion, should not have to pay. If they can pay for a booster and get broadband, then their provider ought to be getting it to them anyway. They shouldn't have to pay extra to have coverage.
$15,000 for Spectrum to run it from Caraway Mountain Road to my house, is what they told me.
Yeah, well, this is your chance to get it, so somebody else foot that bill.
Thank you.
Wow.
That's good information to have. We're in a similar situation, Ryan, so I'll be filling it out too. Any other comments from the board? Hearing none, do I hear a motion to adjourn?
So moved.
Motion from Alan, second.
I'll second.
Second from Courtney. All in favor?
Aye.
All right. Meeting's adjourned. Thank you.